Hello and welcome to another edition of the Lynn Lowdown, and today we have Senator Brendan Crighton here with us. How you doing, sir?
Great to be here. Thanks for having me, Mukala.
Thanks you for coming back. And today we will be discussing the mental health amendments that was recently passed last month, correct?
I think November.
November?
Yeah.
November.
Time flies.
They made the news about it last month.
Yeah, that's correct.
Okay, yeah. But first, Happy New Year. You know, what's it been like the first couple weeks of this month?
It's continues to be a strange world we're living in, but Happy New Year to you too. Best of wishes to everyone watching today, and obviously want everyone to stay healthy, especially during this latest surge. So, but thanks for being here, and hi to everyone at home.
All right. So let's get into this one. What got together to put this together?
So it's something the Senate has worked on for a long time. And in last session, we passed what we call the Mental Health ABC Act. This is now being phrased ABC 2.0 Act, which built off a lot of what we had passed last year that never quite made it to the governor's desk to get signed into law. So I think there's a general recognition across the country and certainly across the state now of what a very large and difficult mental and behavioral health crisis that we're facing. And this is prior to COVID. We had started to shift focus from physical health to mental health, and I think only exacerbated by the pandemic, as many issues across society have been. Yeah, the mental health aspect has really taken a toll on a lot of people the past 2-3 years. No, it really has, and I don't even think we can accurately quantify exactly how bad it is, given that we're still in the midst of a pandemic. So, throughout our history, I think, as a country or society in general across the world, the focus is always on the physical ailments that you have when you're thinking of medical care. What this act really tries to do is put the two on equal footing: mental health and physical health. So just to go through a couple of provisions, if that's cool. So I think one of the big things that we require through this bill is that everyone has an annual wellness exam. So I think most folks, through their their insurance, they know that they can get their annual physical, and certainly that's an important part as well. But for many folks, it's just as important to have a mental health wellness check with a doctor. So this would mandate the coverage for that, so that every year you can check in with the doctor. You make sure you have you're properly being examined, you're asking yourself the right questions, you have a roadmap onto how to get treatment, and you can just talk to someone, which right now it's some may feel comfortable bringing it up to their primary care physician during a physical, many won't. This will make it normalize it a bit more so that everyone can use it. And when you think of younger folks that are physical, that physically fit or don't have many physical issues at the moment and generally very healthy, on the mental health end, it's probably more just as, it is just as important, but probably more important than getting your physical annually. So that's one big provision. Another one really focuses on the parity, making sure that we're paying and we're treating mental health care equally to physical health care when it comes to insurance providers, and when people are actually having these services, to making sure that they're paid out in the most appropriate way. And I think we have laws at the federal level and at the state level already that require this, but there's not a ton of teeth in the enforcement piece. So this would give the Division of Insurance a little bit more teeth in terms of making sure that they can properly investigate, making sure that they can hold folks accountable when they're not treating physical health treatment the same as they would for mental health. So one other piece is, and this is not a foreign concept, and I'm sure many folks have experienced this themselves, right? Right now, our emergency departments are already crowded with COVID cases, but even prior to that, we had something called the emergency room boarding crisis, where if an individual goes, oftentimes the best way to get mental health services is unfortunately, is going to an emergency room. If there's an acute crisis on hand where someone's suffering from a mental health issue, often the pathway to get someone to bed is to go through the emergency room. But what we're finding now is, because of limited resources, both because of the workforce, workforce problems across all sectors, but in particular the health sector. Also, lack of beds and often lack of behavioral health specialists in emergency rooms. So we're saying, a patient shouldn't have to wait days or even months in an emergency room just waiting to be placed somewhere. I mean, that's the worst possible environment for them. It's inhumane. It's immoral. It just keeps one there. It's no fault of, any individual person.
So much going on.
So much going on. Yeah, it's really challenging. So this would go a long way to make sure that, one thing is we put some money towards having a system where hospitals can easily access real-time information as to what beds are available. So this is kind of on the technology, on making sure that, at a time where, hours are important. You have someone there that's willing to seek treatment, but they can't quite find where the beds are. Let's make sure that everyone has access to the information so the hospitals can quickly identify the best place for someone to recover and get the treatment that they need. It also would require that every hospital, regardless of the time of day, has a behavioral health specialist on hand, so that oftentimes when you're in the emergency room, that's the person that would be sitting down and talking to these folks. If the resources are limited and that person can't be there, it just leads to more time for the patient to have no treatment. And also, oftentimes, when folks are actually ending up in the emergency room, it's not your typical 9 to 5 situation. This could happen at 2 o'clock in the morning. You never know. And if an individual gets there and doesn't have that access to care, nothing's preventing them from walking. Many instances just walking out and never getting connected to that treatment, or to sit there and suffer and wait for extended periods of time. I tend to ramble, Mukala, as you know, so I'm going to pause now.
It's all good. That's great information. What are some other provisions in there that are key to it?
I should say too, this bill is like the combination of a dozen or so bills, so it's kind of hard to keep track of every specific detail. But I will say money is important, and in this recent ARPA, the federal money that was passed as part of the ARPA package, back in June or so, we had recently put that money to use through our own ARPA bill, and we had called for $400 million. So that's a good chunk of money. When you look, it was $4 billion total was our package that we passed in November. We put $400 million towards mental health, and 122 million of that would go towards training and retaining the workforce for mental health services. So, for the longest time, I'd started working back in the State House in 2005, so 17 years now. These issues have come up from time to time, and for so often it was, we don't have the beds we need to put people there. That's still true, and we do make investments on expanding, treatment beds and inpatient facilities. But right now, during COVID, what we're seeing is there are beds. There's just not the workforce there to make those beds useful, and it's still, I think, a mystery to many why, where are the workers, and this has certainly disrupted our overall workforce. But I think identifying that need in infusing $122 million will go a long way to hopefully attract folks to that profession and keep them there for what is a crucial time where they're so needed. And
recently there were plenty of people in that field that were let go because these the protocols and all that. So they lost a lot of workers just in the last couple of weeks.
Yeah, it's not a problem that's going away, but I think recognizing it as a state now, is certainly a big part of the problem. I should also say too that this is on a much smaller scale, but since you brought up my amendments earlier, I will brag, I guess, a little bit about we were able to get 2 amendments passed, which depending on the bill, sometimes it's hard. You have a lot of competing interests. Ours were, pretty well received generally, not controversial, but ones that I think will make an impact. In state government, for far too long, folks would think you pass a major piece of legislation, whether it's transportation or healthcare or housing, and we pass that, it's going to be 6, 8, 10 years now before we pass another one. Like you do one big hit and then you go focus on other issues. But I think what we're starting to see a shift, and I think it's across a wide range of issues, but in particular with mental health, is that this is not something we can afford to look at once every few years, or to take our time in, or to waste time rather, and continue to debate these issues without coming to a resolution, without feeling that sense of urgency. So we created a commission, commission, task force, whatever language you want to use around it, but recognizing that these issues are fluid, they're ever changing, especially given the pandemic and other issues around there, that we can't take a snapshot in time, whether it's from 2021 or even 2022, and say, here's the policy that we're going to pass to react to that issue back in that time period. We need to constantly be reviewing this. So the amendment would bring together a wide range of stakeholders to make sure that this issue is being constantly tracked, to making sure that reports are coming out to the legislature, to the administration, so that we're not flat-footed, that we're being proactive and we're preparing for potentially greater levels of uncertainty from the next pandemic. Or it's important that we don't just look at this as a one-time thing.
Especially when the problem doesn't seem to be going away.
Excuse me, no, exactly. And I do see Massachusetts as having an opportunity to be a leader in this space. We have some of the greatest medical institutions in the world. We have some of the greatest educational institutions in the world. We have just a tremendous workforce. And I think folks that have been looking at this issue for a long time. So we should be a leader. We should be a leader both nationally and I think across the world as well. Yeah,
and is there anything in there that kind of focuses on young adults or teenage adults? Because it seems like they've also, especially the ones in high school and stuff, they've also taken a big hit the past couple of years. With the virtual learning that took place all of last year and stuff, and still coming back from that and recovering for that. Is there something in there that helps?
Yeah, no, it's a great point, and I think we're still analyzing overall the overall impact, but obviously it's not. It's going to be a challenge. It's going to be a challenge for so many kids, so many families, and this does just to point to some of the investments, because I think all the stuff in the bill will overall help regardless of age level, but there are some funds that are specified for the youth. So there's recognizing again the issues around workforce. There's a $3 million, and this is in the ARPA bill, not the mental health, but so this is already law. So this money is available now. $3 million for loan payment assistance program to recruit and retain child and adolescent psychiatrists at community and mental health centers. So recognizing we want to attract workforce for all ages for mental health, but in particular, dedicating these funds specifically to attract people to work with younger demographics as well. And then there's also $10 million for the rapid creation of new inpatient mental health acute care beds, particularly those for children and adolescents in underserved communities. So, those are just two things that, I'm sure there are others for. Well, certainly on the boarding crisis, we see that as particularly traumatizing when a child is unable to get the treatment they need and is stuck in a room for days, if not months. So, this, again, moving forward, we need to keep track of this. So this directs the Office of the Child Advocate, which focuses on children, obviously, to produce an annual report on children in ED boarding. So I think it's going to be an evolving issue, as you said, but one that is crucial to the well-being of so many. Yeah,
and what are some of the other bills that you're currently working on or are planning to work on for this upcoming year?
No, thanks for asking. Yeah, there's a wide range of them. We have some deadlines coming up, so committees that are reviewing our bills right now will submit reports on February 2nd. So we're going all out now to try to make the case. That's kind of the first step in getting your bill into being in play. So one bill that I have an eye on that has been a priority of mine for quite some time, and prior was a priority for then Senator McGee, just recently, Mayor McGee, but he, when he was the transportation chair and I worked for him, had really championed a bill that would allow all eligible Massachusetts residents to earn a driver's license. So it's geared towards allowing undocumented immigrants the ability to earn a driver's license, recognizing that your ability to drive a car should have nothing to do with your citizenship, and forever it really hasn't. There are plenty of folks right now that aren't citizens that are able to drive in Massachusetts and across the country. And I think 17 other states at this point have passed similar legislation. It would, in my eyes, increase the safety on our roads, making sure that everyone passes the same criteria to earn a driver's license, that they have insurance. So in other states, you've seen far fewer hit and run accidents. You see more people that have full insurance, which is obviously beneficial for all. And then you just look at just look at the issue in itself. Like, well, why would we prevent residents that are here in Massachusetts from getting a driver's license to drive to work, or to drop their kids off at school, or to go get a COVID test, or to get a vaccine, to go to the grocery store? It blows my mind, and we have a broken immigration system, one that clearly is not going to be solved at the federal government anytime soon. Yeah. But here we have so many families in Massachusetts that we're forcing them to break the law. And you look at the last 2 years, how many times have we praised our frontline workers, our grocery store workers, our human services workers, and they were out there really working hard. So many of them, their statuses or the status member of a family is not one that would allow them to drive. So, hey, keep the economy running, keep everyone safe, but to do so, we're going to ask you to go break the law and live in fear. It's a backward way of thinking. So I'm hoping that the committee, which is reviewing the bill, will get it out over the next 2 weeks, and then that we'll finally have a robust debate and send this to the governor's desk. The governor has said he would veto it. I'm hoping, given the bill has a wide range of support from the major city police chiefs to public health officials, to education officials, to insurance agencies, to major insurers like Arbella has come out in full support of this. So, we have the endorsements across a wide range of folks. I'm hoping that, given some of the changes we've made to the bill, that we could satisfy the governor's concerns, get this passed into law, and do the right thing for so many families.
Yeah, definitely. People driving.
Well, it's inevitable. We don't have a public transportation system in Massachusetts that can get people where they need to go, unfortunately, and that's a whole other problem.
Yeah.
But
I haven't taken public transit in a while, but the last time I did, woo.
Yeah, and some parts of the state don't have it at all. So what are you doing in Western Mass? If you're going to drive, you have to drive to get to work, right? And just on the transportation note, too, we have a handful of bills out there to try to push the state forward on electrification of our transportation sector. And if you just look at the goals we have set in a really ambitious climate change bill last session, in renewable energy bill, that we're not going to meet those requirements for getting to net zero emissions by 2050 and some even sooner dates, unless we go after the transportation sector. So, a big part of the governor, and I'm not knocking the governor by any means, but a big part of the governor's push was, and I applaud him for this, was this transportation climate initiative with other states, where you would basically, there would be a tax on suppliers for, fuel, right? And many of the states were interested in this at first, but sadly, almost every state had backed off. I think as the rising cost of gasoline and other political concerns came up, I think COVID certainly played a role in it, but we've backed out of that. That was going to be responsible for helping us get towards our emissions reduction goals. So that's no longer on the table. Then you look at the hydro energy that we were pursuing from Quebec, and it required a vote, or a vote was taken in Maine that basically killed that plan. Though they're still making efforts to fix it. But two major pieces of our approach for reducing our emissions are gone, wiped off the table. So in my mind, the proposal that we had made to electrify our commuter rail, which would result in more frequent service and subway type fares for a city like Lynn, and clean energy, obviously, it needs to happen now. We can't take our time and continue to deliberate on this. if we're going to meet our goals, if we're going to save the planet, if we're going to be a leader in renewable energy and in tackling climate change, we need to electrify our fleets, starting with commuter rail and bus, and then also working on individual vehicles as well. But anyways, Mukala, I told you I ramble, man, but I get fired up.
It's important information that people need to know. If people want to get in contact with you, please let them know how they can do that.
Yeah, please do. So my email is brendan.crighton at masenate.gov, and our office phone number is 617-722-1350. I'm also on, you can hit me up on my Facebook page or on Twitter. And we have a website as well, brendancrighton.com. But I'd love to hear feedback. It's there's nothing better when you open up your email box and there's emails from constituents that are sharing their thoughts and their opinions. It's crucial to the work that we do.
Yes, definitely. I want to thank you for coming on and giving us all that great information that people need. Make sure if you have any concerns or questions, make sure to contact his office and go to his website or email him, as he said. Also, last note, John said he wanted me to tell you that English be classical. to close out Manning Bowl.
Ask him what the score was this year.
Oh, man.
That's good. John Tebow, my old chief of staff, now Jared Nicholson's chief of staff, was an English Bulldog, and I, as many know, was a classical Ram. Yeah.
He was my teammate.
Oh, really?
Yeah, he was my teammate.
Yeah, I'm sure you spent a lot of time on the bench.
Yeah. You guys been watching Lynn Lowdown. Have a great one.